Tom. Okay, we're back from the break, so let's rejoin Dr. Michael Garko.
And welcome back, and welcome to the Monday edition of Let's Talk Nutrition. Great to be with you. Hope you had a great weekend, and you're off to a good start for the week, tuning into the show. We always have great guests on the show talking about, I like to believe anyway, topics that are relevant to your everyday life. Health can get complicated, but we got to try to find a way to break it down so that we can make sense of it all. My guest today is Dr. Hector Lopez, and Dr. Lopez is a first-time guest on Let's Talk Nutrition. I had a chance to speak with him this morning, and I think you're going to find Dr. Lopez to be very well-informed, upbeat, optimistic. I was talking about optimism. And he's a board-certified specialist. He has a clinical practice. He's a certified specialist in physical medicine and rehabilitation. And he's a researcher. He's a speaker, an author, a clinician, as I said. And he has, he takes an integrative approach to his practice. He's trained as an allopathic physician, but, he earned a master's degree in nutrition, I believe. That he'll clear it up for me. He'll give me the exact title, but I know he's got a master's that relates to nutrition in addition to his work and training as an allopathic physician. And as we go along, he'll do a better job than I talking about how he integrates his practice with different streams of traditions or therapies. And he'll do that. And we're going to be talking about a very important topic today, and that is dealing with your, how can I put this? Your joints, your bones, the osteopathic condition of things in your body. And we'll talk about how Dr. Lopez deals with that with his patients. Dr. Lopez, welcome to the show. It's great to have you on the air.
Oh, thanks for having me on, Dr. Garko. Thanks. It's nice to be on.
How are you?
Good. I'm doing well.
And just so that we have the audience knows, where are you today? Are you in New Jersey?
Yes, I am. I'm actually in New Jersey. I just got back from a conference in Denver this weekend, but I'm back in the office in New Jersey today.
And what was that conference about?
It was actually the American Association of Orthopedic Medicine. So it's a nice progressive group of physicians who try to look outside the box for non-surgical solutions to treating orthopedic injury.
Aha. So let me ask you, Dr. Lopez, when you were going to medical school, and where you are now,
Sure.
The way you think about medicine, the way you're practicing it now, would you say it's in the same galaxy, a different galaxy than when you were in med school, or what? Are they similar, or what? Different?
Yeah, that's a good question, Mike. Actually, I would say it's what's happening with me. It's actually pursuing the path that I'd really envisioned. My background was nutrition and exercise physiology, exercise science, and molecular biology before going to medical school. So I kind of went into medical school with an idea of looking for ways to apply advances in those other areas, not just in medicine, not just in orthopedic medicine, but also in nutrition and exercise, and trying to find a way to really apply them to my everyday patient care.
Mm-hmm. Yeah, and I think, more and more allopathically trained physicians are becoming more integrative in their thinking, in the theory and practice of medicine. Would you agree with that or not?
Absolutely, yeah. I think we're starting to head into an exciting time in medicine. On the one hand, on the other hand, we have some challenges still ahead of us. But I do agree that in general, I think this newer generations of physicians have been a little more open-minded to looking at other solutions and doing just that, looking outside the box of traditional allopathic medicine for finding ways to treat their patients.
And in your clinical, so the audience has a sense of what you're doing on a day-to-day basis with patients. What basically your practice? What is it constituted? What kinds of patients do you have coming in? What kinds of health issues do you deal with generally?
Sure. Well, it's a spine and sports medicine practice, and a way to sort of think of what it is that I do is if you think of a non-surgical orthopedic medical practice. That's basically what I do. So I see the full gamut of neck and lower back injuries all the way to shoulder, hip, knee, elbows, carpal tunnel. So anything that's causing pain or dysfunction, whether you're a high-level elite athlete or whether you're just, the everyday Joe or Jane who needs to function at a high level at work or at home with their family, recreationally, et cetera. So that's pretty much the practice.
Although you said spine and sports medicine, you have lay people that come into the practice as well.
Oh, absolutely. As a matter of fact, and this is something I think we were discussing this earlier, I actually have the small minority of my practice are what you would call, athletes or elite level, high level athletes. The majority of my patients are just everyday working individuals, professionals all the way to blue collar workers and laborers that get hurt either on the job or at home or trying to get back into a fitness lifestyle. And those are basically the patients that show up at our office.
Yeah, and orthopedic issues, whether it's neck, lower back, whether it's with your hands, your feet, whatever, the joints, there's a four-letter word that gets implicated, and it starts with P.
Yeah, well, I guess that's another four-letter word. Yeah, there are quite a few four-letter words.
Pain. I'm talking about pain. I bet that's what.
Hand in hand, yeah.
I bet that's what you deal with a lot in your practice. People, please, I don't care what you do, short of amputation, please make this pain go away. Yes.
Right. No, absolutely. Yeah, pain is definitely a major component of anything orthopedic or musculoskeletal. Absolutely. Yeah.
Do you prescribe? And again, please understand, my show. This is not a show where it's, how can I put this? Ideological that things are excluded. Medications, pharmacological treatment, whatever it takes. Do you prescribe medications, drugs to help with pain management and that kind of thing?
Yeah, I do. I certainly do. Again, as you were saying, my background as an allopathic physician is in physical medicine rehabilitation, and then my interest is in spine and sports medicine. But in our practice, I have an integrated practice, so I also have physical therapists. I have chiropractor in the office as well. So we're able to use really the full gamut of tools, all non-surgical in nature. And medication management is definitely a part of it. Although I would say I'm definitely a minimalist, and I also use nutritional strategies as well. We can call it nutritional intervention, if you will, and also procedures. I also do various spinal procedures as well as peripheral joint injections and treat tendon or ligament injury via injections as well.
Do you have a lot of patients come into your practice, Dr. Lopez, who are overweight and obese and have issues, orthopedic issues in particular with their knees?
Absolutely. It's a resounding yes.
Okay. When we come back, I want to talk about that a little bit with you. I also want to, I was talking about optimism when I opened the show today, and I want to get your take on that and what you notice. You can maybe think about this during the break, that patients that you would perceive to be perhaps maybe optimistic, some pessimistic, maybe some too optimistic or too pessimistic, and how does that play into their approach to healing them, getting the body to heal itself, their compliance with the medications or the protocols that you give them. We're going to talk about that with Dr. Lopez. That'll be next on Let's Talk Nutrition after these important messages.
Let's Talk Nutrition is brought to you by Strauss Herb Company. Everything our bodies need is provided by nature. Kyolic, aging makes the finest garlic truly odorless. Natrol, nourishing the potential of mind and body. Yerba Prima, pioneers in internal cleansing. Jarrow Formulas, superior nutrition and formulation. Twin Lab, answers for life. Let's Talk Nutrition, on the web at letstalknutrition.com. We're back from the break, so let's rejoin Dr. Michael Garko.
And welcome back. According to the CDC, tens of millions of Americans suffer from chronic joint pain, maybe 70 million or more. And it's a big issue. And, you know, it's orthopedically related. And my guest today, Dr. Hector Lopez, is just right up his alley. And more often than not, for example, with joint pain. Now, remember, there are other kinds of issues. It's not just limited to joint pain, but that is orthopedic practice. But it's usually caused by inflammation stemming maybe perhaps from an injury, an infection, like caused by a bacterium or a virus, or inflammatory autoimmune-based disease such as arthritis of one sort or another, rheumatoid arthritis, for example. And so the inflammatory-related cause of joint pain, you know, I'm sure that Dr. Lopez has to deal with this all the time. And I mentioned to him that probably gets a lot of patients talking about pain. And that pain comes from from a structural issue or whatever, Dr. Lopez, but a lot of it's inflammation related, right?
Absolutely, yeah. Inflammation, it's a little bit of a source of controversy, I feel, because inflammation is actually the first step to normal, healthy healing. It's an innate response that's been there. Even in across the animal kingdom, in other animals as well, and it's an essential part of healing an injury. But when inflammation goes awry, or if a patient has an incomplete healing response, where they're kind of caught in this chronic cycle of systemic inflammation as well as a local inflammatory process, or if a patient has some sort of an immune disorder, like rheumatoid arthritis, which is a different type of arthritis, then those are situations that require us to try to temper the immune response a little bit. And I like to tell patients it's not just about completely isolating and knocking out inflammation, because if you had zero inflammatory response, you wouldn't survive very long. So you need a healthy inflammatory response, and that's something that we can do using some nutritional strategies. I feel is really get patients to have a more functional immune response, if you will.
That very well said and put. And I suspect that a lot of patients that you see in your practice have taken over-the-counter and prescription NSAIDs like salicylates, such as aspirin, ibuprofen, such as Advil or Motrin, naproxen, which is Aleve, right?
Absolutely.
COX-2 inhibitors. I bet they show up with all kinds of. Do they always tell you the truth as to how much they're taking?
No.
No.
No, they usually don't. But you can surmise how much they're taking, and usually get it out of them at some point throughout the history if you take enough time to talk to them, which is another issue with medicine these days, I suppose. But that might be another topic for another day. But yes, many of them do come to the office having taken very large amounts of anti-inflammatory medications, and quite frankly, I like to use NSAIDs or non-steroidal anti-inflammatories the way primary care docs use antibiotics. A short course, make it a short, effective course, and if it's not working beyond the 7 to 10 day or 7 to 14 day mark, then unless there's a very unique condition, I feel there's very little that a long-term NSAID is going to do for a patient.
And when we were headed into that last set of commercial messages, I alluded to overweight and obese patients coming into your practice with, I suspect, oftentimes ankle issues, feet, their knees. You deal with that a lot, I suspect, these days.
Oh, yes, absolutely. Overweight and obesity can impact just about every aspect of the orthopedic organ system, if you will. Just about all muscles, joints, ligaments, tendons, and bones are affected in one way, shape, or form by someone who is obese or overweight. And most of the time, the overweight condition is going to lead to worse outcomes, meaning that a standard patient who has a standard injury, comparing someone who's overweight or obese versus someone who's in an ideal body weight situation, the overweight or obese individual is going to take longer to get back to normal function. They're usually going to take longer to see their pain scores drop to a normal level. And so their outcomes are typically not as good. And there are many reasons for that. Some of it is very complicated, molecular, biochemical, hormonal. And then other aspects of it are a lot more simple, like just mechanical loading. It makes sense that if you've got someone who's 130 pounds overweight and they've got knee pain or they've got a knee injury and they're continually loading that knee or the hip or the ankle or the lower back, with that overweight condition, that it's going to also precipitate a tougher recovery.
I know you're a young man, and so you haven't been in practice 50 years, and so I can't ask you a longitudinal kinds of question, but and I don't even know how many. I've
been practicing long enough to at least see a good number of trends over a decade.
Okay, there's one trend I want to ask about. And that is with children. Do you notice a difference, especially in orthopedic? It seems to me orthopedic issues really bring home the whole issue of mind and body because of the pain that's involved. Do you see a difference between your patients who are optimistic or tend to be more optimistic and compared to patients who are pessimistic? You can answer that when we come back. Think about that. I'm curious as to whether or not that's even an issue in your practice, or you've thought about it, or you even notice any difference. The research suggests that there is a difference, but I love having doctors such as yourself on the show because you're a clinician. You're in the
where we're seeing younger patient populations coming in with injuries due specifically to being overweight or obese. Absolutely, and I know I see it in my practice often. So.
Mm-hmm. It's always interesting. And then, lest I forget, in your practice, and in talking with you this morning in our brief conversation, listening to you now on the air, it's interesting when you do a radio show 5 days a week, 2 hours a day. I can't see you, but I can. It's interesting what you can learn about a person just by listening to their voice and the inflection and their tone and what how they say things and what they say. You seem like a pretty optimistic person to me. I don't get the impression that Dr. Lopez walks around with a gloom and doom attitude. I don't get that impression. Am I right about that?
You're definitely on the money there. Yeah.
Okay, so given that, when you have your
nice segue to the Sigerstrom.
Yeah, we're going to give you. I'm going to send you a Rorschach, and we're going to get you all lined up here psychologically. With your patients, I'm a big fan of and I know that given your integrative approach, the connection between the mind and the body. Do you notice a difference, especially in orthopedic? It seems to me orthopedic issues really bring home the whole issue of mind and body because of the pain that's involved. Do you see a difference between your patients who are optimistic or tend to be more optimistic and compared to patients who are pessimistic? You can answer that when we come back. Think about that. I'm curious as to whether or not that's even an issue in your practice, or you've thought about it, or you even notice any difference. The research suggests that there is a difference, but I love having doctors such as yourself on the show because you're a clinician. You're in the trench every day dealing with real issues, real people, real pain and whatnot, and solutions you got to come up with. My guest is Dr. Hector Lopez. Dr. Lopez has a great practice up in New Jersey. When we come back, I'll ask him if there's a website you can go to check him out. And as you can see, Dr. Lopez is optimistic himself and quite bright and very knowledgeable. We're delighted to have him on as a first-time guest. We'll talk more with Dr. Lopez in just a moment.
Kyolic aged garlic extract is already known to support healthy cholesterol levels and reduce other multiple risk factors associated with heart disease. Now, a breakthrough clinical study from a UCLA medical center shows Kyolic reduces another major cardiovascular risk factor, plaque formation. Plaque is a fatty deposit that clogs arterial walls. Excess plaque causes circulation problems in coronary arteries. In this new discovery, patients at high risk for heart disease had significantly lower coronary plaque formation after consuming Kyolic. 1 in 5 males and females has some form of cardiovascular disease, so reduce your risk not only by eating healthy and getting proper exercise, but also by taking Kyolic. With more than 350 studies completed, Kyolic is the most scientifically researched garlic supplement and the only aged garlic extract supplement available. Discover organic and odorless Kyolic aged garlic extract at your favorite health food store today.
The many health benefits of omega-3 fish oil include a healthy heart and brain, flexible joints, and a healthy metabolism. But for many people, fish oil can be hard to take. So Nordic Naturals came up with a whole new way to get your omega-3s. With new omega-3 Effervescent. Just add water and enjoy a fruity effervescent drink. You won't even know you're taking fish oil. And the single-serving packets let you drink your omega-3s anywhere you want. Made from sustainably harvested Arctic cod from Norwegian waters, Nordic Naturals Omega-3 Effervescent is an excellent source of omega-3s for adults and kids alike. And we've also added vitamin D3 for additional health support. All with the same industry-leading purity and freshness that you can expect from all Nordic Naturals products. For more information about Nordic Naturals Omega-3 Effervescent, visit www.drinkyouromegas.com. Nordic Naturals, committed to the planet, committed to pure and great tasting omega oils.
My name's Henry Small, and I'm a 62-year-old musician, producer, and radio personality. I've been using Strauss Herb Company products for over 15 years, and they've worked for me. The Strauss family has had over 8 generations of herbalists, developing their formulas in an effort to improve people's lives. Strauss products have made such a difference in my life. Let them make a difference in yours.
Be inspired by Strauss Natural Healthcare Products.
Let's Talk Nutrition is brought to you by New Chapter, the benefit of nature's wisdom. Nordic Naturals, pure and great tasting omega oils. Genesis Today, food with purpose, pure and simple. Nutricology, innovative nutrition. Renew Life, the digestive care company. Panacea 315, superior quality, superior taste. Let's Talk Nutrition on the web at letstalknutrition.com. We're back from the break, so let's rejoin Dr. Michael Garko.
And welcome back. My guest is Dr. Hector Lopez, and it's great to have Dr. Lopez on. He's talking about, we're talking about, I guess, generally speaking, and I need to get I'm asking for a real definition of what orthopedic medicine is. And that implicates what, Dr. Lopez? The skeletal system, muscles, joints, ligaments, and so on?
Yeah, sure. Another name for it would be musculoskeletal medicine, which is a mouthful, but basically any pain, injury, or dysfunction that involves muscles, tendons, ligaments, joints, and the spine.
Mm-hmm. Okay. So this business about whether the patient is optimistic or pessimistic, do you think it makes a difference or no?
I would say absolutely, big time. Anecdotally and empirically in our patient population, we see it often. From beginning to end, from the first time I meet a patient, I'm also trying to take in what makes this patient tick, what drives this individual as a human being. Because if all I'm interested in is a diagnosis and all I'm looking for is a diagnostic code, and then what medication and what injection or what procedure can I perform on this patient, you're really going to miss the boat with many of our patients in terms of really being able to provide the best care for them. So patients who tend to be optimistic from the beginning, they really seem to hit the ground running when we put them into rehab and get them into therapy and get them into their corrective exercise programs. They tend to be more compliant, and there are probably many reasons for why they do better generally after an injury. I know that in the study that you referenced earlier today in the Segerstrom article.
Yes.
And that study they looked at the connection between immune responses and optimism. And even, it's interesting because I've often spoken about at presentations, at conferences, I've talked about these axes, right, that exist in the body, like the psycho, neuro, endo, immune axis. And all that means is that it's probably not so much of an axis, because an axis kind of implies that there's priority, right? That one thing is more important than the other in an orderly fashion. I think it's probably more of a network, and that's probably how we should think of it in terms of the brain and mental health having an effect on the immune system, and the immune system also talks to the hormonal system in the body and affects hormones, which then also affects the health of the very cells in the musculoskeletal system or the orthopedic system that we're trying to get better, right? So there's this really intricate web that you can kind of see how someone who comes in depressed will tend to experience more pain. They're destined.
There's such a thing as learned helplessness or this pessimism, and people can learn to be pessimistic. You can learn to be optimistic. In other words, you can change. So if you're pessimistic, you can learn to be more optimistic, and it does make a difference in quality of life and quality of health, and so on. That was interesting to hear you describe it that way.
Well, that's actually a great point, because it actually our best cases or our most successful case histories are patients who may come in more pessimistic and over ankle sprain or a knee sprain or lower back injury. You can really start seeing how this is a very intricate system, and optimism certainly plays a huge role.
It's interesting stuff. That you're probably the first guest that when I've asked that question, you're the first guest to really give an insight into what goes on in the clinical setting with patients. That was excellent. It confirms everything that's in the literature, and Martin Seligman talks about learned helplessness, that people or some people would seem to just be pessimistic. Well, I mean, whatever genetically happens in terms of chemicals, I don't know, but there's such a thing as learned helplessness or this pessimism, and people can learn to be pessimistic. You can learn to be optimistic. In other words, you can change. So if you're pessimistic, you can learn to be more optimistic, and it does make a difference in quality of life and quality of health, and so on. That was interesting to hear you describe it that way.
Well, that's actually a great point, because it actually our best cases or our most successful case histories are patients who may come in more pessimistic, and over time, because they're coming into our office, we're able to sort of start seeing a change in their behavior pattern, and so this is not just a one-track destined behavior that a patient needs to stay on. There are things you can do in a clinical setting to actually shift them a little more towards that optimistic behavior pattern, and you can see them start doing really well. So
yeah, an emphasis on the word behavior, and I talk about that a lot on Let's Talk Nutrition, Dr. Lopez, that health is not just biochemical, it's psychological, it's behavioral, it's cultural, it's many different things. You mentioned that in your practice, you have physical therapists, chiropractor, you have prescription management, pain, medication management. And then you said nutritional interventions. Talk a little bit about that in your practice, and what are the kinds of supplements or nutrients or foods that you find very helpful?
Well, typically when a patient comes into the office and they're going to get some rehabilitation for whatever injury they're coming in for, the nutritional aspect or the nutritional component or intervention usually starts with a very brief talk about just their general dietary habits. And we talk about the omega-3 to omega-6 ratio, omega-6 to omega-3 ratio. We talk about foods that are known to be quote-unquote inflammatory foods, and other foods that may have anti-inflammatory properties. And although that is helpful in the individual who will take note and actually implement those changes, I learned very quickly that patients respond much quicker and much more effectively to a prescription. So what I often do is I'll talk to them. I'll talk to them about what they should be doing nutritionally in their everyday habits. With the foods they're choosing and the food options they're choosing. I'll actually write prescriptions for things like high-dose fish oil, high-dose vitamin D, and other components, also certain polyphenolic.
I can just imagine. I can just see a patient sitting there, and Dr. Lopez is passionately talking about, well, Paul, nutritionally, and you're going on, and he's waiting for the most important line. And I'm going to write you a prescription for, and he's looking for that painkiller. And Dr. Lopez is waxing and waning eloquently on nutrition. He said, gee, this guy's bothering me with this nutrition business. Right. I bet that happens, no?
It does. So I've gotten better at really trying to sort of almost mask my nutritional prescription as a real prescription. So
see,
and they leave and say, "Oh, okay, it's nutrition as medicine, right?"
Medicine. Yeah, let food be your medicine and medicine your food.
There you go. Hippocrates knew what he was talking about.
He certainly did. This is great stuff, Dr. Lopez. You're listening to Dr. Hector Lopez, and Dr. Lopez is going to be with us in the second hour as well. And he one of the first things out of his mouth, and I said, nutritional intervention, omega-3, omega-6 ratio. We're going to come back with that. And always remember, you get all your supplements at Vitamin Discount Center stores. And never forget, your health is your wealth, and your health is the wealth of those who care about and love you. I'll see you in a moment.
Experience a new beginning to health with Genesis Today. Genesis Today was founded by Dr. Lindsay Duncan, who has a rich history as a practicing certified nutritionist, a naturopathic doctor, and an award-winning product formulator. One of Genesis Today's more important products is Acai 100, the world's first 100% pure wild-harvested Brazilian acai, supporting healthy joints and a healthy inflammatory process. 1 ounce of Genesis Today's Acai 100 has over 3.5 times the anthocyanin levels of red wine, as well as naturally occurring plant-based EFAs similar to those found in olive oil. Acai 100 comes in a 32-ounce glass bottle and is absolutely 100% pure, containing nothing added, not even water. Most people feel the effects of Genesis Today's pure products within 20 to 30 minutes of consumption. You can find Acai 100 and other pure Genesis Today's products at your local health food stores. Experience a new beginning to health with Genesis Today.
Send your kids back to school with a nutritional edge. Top-selling Rainbow Light Gummy Vitamins. These great-tasting, all-natural gummies are gluten-free and contain no artificial colors, flavors, or preservatives. Just optimal potencies to support growing minds and bodies. Sugar-free Fiber Garden Gummies provide 3 grams of fiber and antioxidants equal to 2 servings of fruits and veggies to help round out even the most finicky eaters' diets. Gummy Omegalicious Omega-3 formula supports healthy brain function with the omegas DHA and EPA plus vitamin C. Gummy Omegalicious is molecularly distilled and third-party tested to ensure premium purity. There's no fishy aftertaste, just sweet, tangy raspberry goodness kids love. Rainbow Light Gummies are available in Stay Fresh single-serve packets that make a great addition to lunchboxes or for kids on the go anytime. Other delicious Rainbow Light Gummies include Gummy Bear Essentials and Kids Power Sours multivitamins, Gummy Vitamin C Slices, and Vitamin D Sunny Gummies. This school year, Rainbow Light Gummies make the grade for optimal nutritional support your kids will love.
And welcome to the second hour of Let's Talk Nutrition. Great to be with you. If you missed the first hour, no worries. It's uploaded on my website and archived at letstalknutrition.com. Click on show schedule. You'll find it there. And you'll learn that my guest today is Dr. Hector Lopez. And also, when you're at the website, you can see that you're able to catch the show online just by clicking on Listen Live. And on the radio, the show broadcasts on AM 1250 WINS, WHNZ out of Tampa, Florida, and all parts beyond via the internet. When we get outside the Tampa Bay area, although this is a 25,000-watt station, it can't get to Canada and Europe and other places, which there are people who listen in those places. You'd be surprised. And we're happy that they're there. And good show so far, I think, very much. I'm enjoying Dr. Lopez. Has a real honest and, I think, authentic way of talking about being a doctor and being, in his specialty, in his area. He's a certified specialist in physical medicine and rehabilitation. He's an active researcher, a speaker, an author, a clinician, and he has an integrative practice. And he talked about that. And one part of that practice, that integration that we're talking about, are nutritional interventions. And when I asked him about that when we were headed into the top of the hour, one of the first things out of his mouth when I mentioned nutritional interventions was the omega-3, omega-6 ratio. And I guess a lot of people are wondering, Dr. Lopez, what would that have to do with orthopedic issues like, sore bones, muscles, joints, torn ligaments and tendons and whatnot? What would that have to do with anything?
Sure. Well, first, thanks for the compliments, and I'm also having fun here. I enjoy doing this. Now, as far as the omega-6 to 3 ratio we were going to get into, the fatty acids that we consume are incorporated into our cells, into our structures. So they become part of our cell membranes or plasma membranes. Whenever there's an injury, there are enzymes that are activated that actually take some of those structures, like in the membranes, those fatty acids, and start processing them through these pathways, the inflammatory pathways. They're also called eicosanoid metabolism, which the body takes these fatty acids, it runs them through a set of metabolic pathways and biochemical reactions through different enzymes. Those enzymes like COX-1 and COX-2, which you mentioned, COX-2 inhibitors earlier, or the non-steroidal anti-inflammatories, actually act on those very enzymes. And so when these fats are the raw materials that are used to flux through these enzymes, the end products are these little chemicals called prostaglandins, leukotrienes, and thromboxanes. So there's a lot of, complicated terminology there, but the long and short of it is that these little chemicals control things like pain, sensitivity to pain, inflammation, the swelling, the edema, the redness that patients typically feel after an injury. And that's something I think most of us can relate to. Mm-hmm. Now, where the omega-6 to 3 ratio comes in is quite simply if the body uses an omega-6 fatty acid, it typically gets processed into the more inflammatory cytokines or the more inflammatory eicosanoids, the inflammatory chemicals. And if the body utilizes the omega-3s instead, particularly things like EPA and DHA from fish oil, then the end products, the downstream end products, are going to be, they're actually somewhat anti-inflammatory prostaglandins and anti-inflammatory leukotrienes. So what you eat in terms of your fat selection has a lot to do with what you end up feeling and how quickly you can recover from an injury, and that's just one aspect of it, not to mention everything else it's doing for systemic inflammation and everything else it's doing for cardiovascular health and immune system health, and even the brain. We talked about the whole psychologic connection to pain. Well, it just so happens that the number one supplement I use in my patients, high-dose fish oil, also has a positive effect on mood and on depression and even on anxiety. So we can really target many layers of a patient's injury, whether it's physical, mental, psychological, and biochemical, with one high-dose supplement.
Mm-hmm. So when you're writing that prescription for, let's say, omega-3 fatty acid or fish oil, so do you write on a prescription pad, omega-3 fatty acid / fish oil, get it anywhere, where you buy your lawn and garden supplies, doesn't make any difference what the brand is? You don't put that on a prescription pad.
No, of course not. It's very important that, I mean, for me, the things that make a good fish oil supplement, and certainly, you know, there are a few out there, but one of my favorites is Nordic Naturals, and the reason for it is because some of the things I look at when I'm prescribing any supplement, really, for my patient population is purity, of course. It needs to be dependable, and you need to make sure that they're free of things like heavy metals, like mercury and lead and dioxins and all these other environmental toxins. It needs to be fresh, because freshness can affect the quality of the fish oil and the oxidation status. The fact that it's in its triglyceride form is important to me, and third-party testing, and the fact that they sponsor independent research on their finished product. That's very important. So those are some of the reasons why I like Nordic for my patient population, and the potency is important too. You know, if you were to use regular over-the-counter fish oil, to get some of the doses that I prescribe for my patients, which I get many of my patients up to 3 to 4 grams of EPA.
That was my question. Okay. Now because that's gonna. In fact, I got an email here exactly on that question. Roberta wants to know how much. What's the dosage, Dr. Lopez?
Well, typically how much depends on for who and for what reason, but in my patient population, because most of my patients are seeing me for pain or injury or inflammation, and they're usually also overweight and have metabolic syndrome and cardiovascular risk factors and all those other things, I typically use a high dose of 3 to 4 grams of EPA plus DHA. Now, this is important here because if you just pick up any soft gel, any fish oil over the counter, and you look on the back of the bottle, typically most soft gels are going to be standardized for 30% EPA plus DHA, which means that every 1 gram fish oil will actually only contain 300 milligrams of EPA and DHA. Usually it's 180 grams of milligrams of EPA and 120 milligrams of DHA. So that would mean that patient would have to take 10 to 15 soft gels a day. And, try telling patients that they're going to have to take 10 to 15 soft gels a day, and that's just one thing they're going to need to do. And, you'll have a tough time getting a compliant patient population.
Mm-hmm. So on the bottle, like on Nordic Naturals, I use Nordic Naturals Ultimate Omega.
Sure.
Okay,
Yeah.
I love that.
Product, yeah.
I love that because it's high dosage. To get 3 or 4, let's say that's to get 3 grams. Mm-hmm. What on the back of the bottle? When does it take?
Add that up. When you add the DHA plus EPA, you're going to get about 600 to 650 milligrams combined per soft gel. So I typically get patients to take 4 to 5 soft gels or 4 to 6 soft gels in some cases.
There you go.
Of that product.
Yeah, and I'll tell this story. I told it once before, but I'll tell it again when I come back about this person that I bumped into when I was visiting one of the Vitamin Discount Center stores not too long ago, and deals with dosage. And I'm mindful that people don't. You shouldn't overdose. On anything. Too much water and you drown. So we have to be careful. But that being said, I think with chronic pain, joint issues, that we're talking about today with Dr. Lopez, his recommendation of 3 to 4 grams is a good one. We'll continue this conversation with Dr. Lopez here on Let's Talk Nutrition.
Did you know that the most common form of calcium supplement today is calcium carbonate, also known as limestone? You don't eat rocks as part of your balanced diet, so why would you choose to supplement your bone health nutritional needs with limestone? Our bodies understand and seek whole food sources of nutrition. New Chapter is proud to deliver Bone Strength Take Care, a calcium complex that delivers key bone health nutrients in the form of whole food, not rocks. Bone Strength Take Care also delivers key bone nourishing nutrients, including vitamins D3 and K2. Vitamin K2 is of critical importance as it ensures calcium is placed in the bone where it's needed and stays out of the arteries where it's not. Discover for yourself the whole food bone health alternative to rocks. Bone Strength Take Care, the best-selling natural bone health supplement in America. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any
The
disease.
fresher the food, the more rich in nutrients it is, right? What if your daily multivitamin was made from fresh food? Introducing Real Food Organics Women's Daily Nutrition from Country Life Vitamins. Made from over 50 raw fruits and vegetables specifically to support a woman's health needs. Real Food Organics Women's Daily Nutrition is so packed with fresh food, it actually provides 2 servings of fruits and vegetables. Go to realfoodorganics.com to locate a retailer near you and get your nutrition from real food. Real Food Organics Women's Daily Nutrition from Country Life Vitamins.
Feel tired, lethargic, or irritable? Take Solace. You're one of millions of Americans that has trouble falling asleep or staying asleep. What can you do about it? You can take Solace. Solace is an all-natural, non-addictive dietary supplement formulated to help you fall asleep and stay asleep naturally. Take Solace and feel the calming effects of this extensively researched sleep and relaxation aid. For more information on Solace, call toll-free 877-533-7066 or visit the website at takesolace.com. That's SOLUS.com.
For nearly 15 years, Nordic Naturals has been setting the standard of high-quality fish oil, offering exceptional taste, industry-leading purity, and unsurpassed freshness. But did you know that all fish oils are not created equal? Lower quality fish oil can contain environmental toxins such as mercury, have a fishy taste or smell due to rancidity, or be harvested unsustainably. Nordic Naturals is a brand you can always rely on, just as medical doctors and researchers have for years. All Nordic Natural fish oils are third-party tested to exceed all international standards for purity and freshness, and are in the natural triglyceride form to ensure optimal absorption and thus better results. Nordic Naturals fish oils also offer the reassurance that our fish are always sourced sustainably according to Norwegian fishing policies, which are the most stringent in the world. Taste for yourself why Nordic Naturals is the leading omega-3 fish oil brand in the U.S. Visit NordicNaturals.com today. Nordic Naturals, committed to a healthy planet, committed to pure and great-tasting omega oils.
Let's Talk Nutrition is brought to you by A. Vogel, pioneer in natural health since 1923. Country Life, a leader and authority in natural health and nutrition. Form Essentials, makers of the all-natural sleep and relaxation aid Solace. Garden of Life, empowering extraordinary health. Sprung Chanson, putting herbal remedies back on the map. Rainbow Light Certified Organics, for a stronger state of health. Let's Talk Nutrition, on the web at letstalknutrition.com. Okay, we're back from the break, so let's rejoin Dr. Michael Garko.
Back in 2005, the U.S. Food and Drug Administration issued a warning about NSAIDs and their increase, and that they increase the risk for adverse cardiovascular events like heart attack and stroke, and gastrointestinal events like gastrointestinal bleeding. Then, in the New England Journal of Medicine, they had published, this was earlier or later, they said that, quote, it has been estimated conservatively that 16,500 NSAID-related deaths occur among patients with rheumatoid arthritis or osteoarthritis every year in the United States. This figure is similar to the number of deaths from the acquired immunodeficiency syndrome and considerably greater than the number of deaths from multiple myeloma, asthma, cervical cancer, Hodgkin's disease, and so on. If deaths from gastrointestinal toxic effects from NSAIDs were tabulated separately in the National Vital Statistics reports, these effects would constitute the 15th most common cause of death in the U.S. So you get the point that NSAIDs, while they can help with pain, especially when you're dealing with joint pain, muscle issues, chronic issues dealing with your musculoskeletal system, they have a downside. And although Dr. Lopez, my guest today, will prescribe medications and NSAIDs, prescription meds and NSAIDs, he does that, he said, on a short-term basis, but he also has nutritional interventions. And one of the things to help modulate pain, which is inspired by inflammation, is to use fish oil. And he was talking about Nordic Naturals, and we're talking about the dosage. And you were recommending, Dr. Lopez, 3 to 4 grams. What if you have a patient that has severe chronic pain, like knee pain, either due to an injury or just deterioration of the cartilage or whatnot? Does 3 grams of fish oil help, or is it just like throwing a bucket of water on a raging fire?
Well, it's usually not going to be enough, and there is, again, there's no panacea. There is no one silver bullet. I wish I had for many of my patients, but that's just usually it doesn't exist for patients with chronic conditions like that. So although that's one tool we use, we have many tools in our toolbox that we can reach into in order to get them better faster. And again, you mentioned, I do use more traditional allopathic medications and procedures, et cetera, often to sort of bridge them, to get them to the point where now they're able to do things on a more long-term basis that's going to keep them out of trouble, like changing what they're eating and their dietary patterns, as well as supplementing with some of these nutraceuticals that can really impact their health and well-being long-term.
Mm-hmm. Yeah, it's a combination. It's the integration of traditional allopathic therapies and procedures, protocols, along with the more natural medicine, alternative, for lack of a better term, approaches. What's the difference? I'm sorry, go ahead.
Yeah, no, I was actually just going to mention that I feel I'd be doing my patients a disservice if I didn't offer them what I felt was the best available solutions or integration of solutions, in order to get them better, faster, and keep them well. So that does include the traditional allopathic approaches as well. So.
Of course. What's the difference? This may seem like a mundane question to you, but what's the difference between a strain and a sprain?
Yeah, well, the technical term strain typically refers to an injury to muscle and tendon. So, whereas a sprain refers to injury to a ligament. And muscle and tendon, of course, attaches from one bone to another, typically across a joint, to produce movement. So you can contract a muscle and a tendon unit. You can't contract a ligament. The ligaments typically connect bone to bone, and a tendon connects muscle to bone. So that's the technical difference between a strain and a sprain, but they usually occur together. So that's why you may hear a physician say, well, it's a sprain strain. They may actually use it synonymously because if there's an injury, like let's say you were heading down the stairs too quickly, you didn't realize you had a misstep, and you twisted your ankle, or you had a sudden jerky maneuver down the stairs, and you hurt your knee, you're probably going to have both elements of a strain to the muscle and tendons that cross that joint, as well as a sprain to the ligaments that keep that joint stable.
And just to remind the audience, the classic signs of inflammation, there are 5 of them: heat, swelling, redness, pain, and loss of function. You don't need to necessarily remember that operationalization of inflammation, because if you have it, you'll know it.
Oh, yeah. You'll know when something is wrong if you're not able to do things as you normally are able to. Or the perception of pain is definitely pretty prevalent. Yeah, you'll feel it.
And you mentioned earlier, and it's a point well taken, that inflammation is the body's own natural response to an injury, to an infection. It's your immune system doing what it was designed to do. But we have cases. Do you deal with patients who have arthritis, Dr. Lopez?
Yes. Oh, yes. It's very prevalent. It's the second leading cause of disability in the country is osteoarthritis. So, absolutely.
Yes.
Yes.
What rheumatoid arthritis are all arthritis conditions autoimmune?
No.
No. Okay. Good. Rheumatoid arthritis is, right?
Absolutely, yes. Rheumatoid arthritis would be a type or a form of arthritis that's, although it's not as common as osteoarthritis, which is your wear and tear, typical degenerative arthritis. Rheumatoid arthritis is usually a more severe form because it's basically the immune system attacking itself. So you get although there are elements of the immune system involved in osteoarthritis, it's nowhere near as intense or as severe as it is in rheumatoid arthritis, where these patients typically develop very severe deformities of the hands and digits and wrists, and it even increases systemic inflammation to the point where a patient with rheumatoid arthritis is 30 to 40% more likely of suffering from a heart attack, from an MI, than a patient without rheumatoid arthritis.
Why is that?
Well, there are various theories for that. The main prevailing one is actually not pain. It's actually the fact that because their immune system is running amok, and the immune system is also involved in creating inflammation in other areas, like the blood vessel walls, right?
The arteries. Mm-hmm.
The arteries, exactly. So the coronary arteries can get involved. The heart muscle tends to not be as resilient because you have a bunch of these floating inflammatory chemicals that are just flooding the system, and so it has some of these other untoward effects.
I was before I came on the show today, I went to PubMed, which I always encourage the listener to do to get smart, because this show's information based, evidence based, and I found studies looking at the omega-3 polyunsaturated fatty acid supplementation to help modulate inflammatory joint pain and for rheumatoid arthritis. There are studies out there then that would suggest that taking omega-3 would help somebody with rheumatoid arthritis.
Oh, there's definitely evidence, yeah. For rheumatoid arthritis, there's also some preliminary evidence for other areas as well, such as chronic neck and lower back pain, which Dr. Maroon was involved in that study as well.
Mm-hmm. And I know, given the statistics on arthritis, that probably many folks listening to this show suffer from arthritis, and I didn't get to the story about the lady that I bumped into. I'll tell that story when we come back from these important messages that are coming up, and we're at the halfway point here on Let's Talk Nutrition with my guest today, Dr. Hector Lopez. We'll be back.
Let's Talk Nutrition is brought to you by Strauss Herb Company. Everything our bodies need is provided by nature. Kyolic, aging makes the finest garlic truly odorless. Natrol, nourishing the potential of mind and body. Yerba Prima, pioneers in internal cleansing. Jarrow Formulas, superior nutrition and formulation. Twin Lab, answers for life. Let's Talk Nutrition on the web at letstalknutrition.com. We're back from the break, so let's rejoin Dr. Michael Garko.
And welcome back. My guest today is Dr. Lopez, Hector Lopez, and having just a great conversation with Dr. Lopez today about matters related to your musculoskeletal system, your muscles, your tendons, your ligaments, and so on, and the pain associated with that and the kinds of injuries that people suffer, both athletes and non-athletes, and he has a very vibrant practice up in New Jersey. And there are scores, if not hundreds, of studies that look at the taking omega-3 fatty acids and helping with inflammation, helping with your joints. I came across one, Dr. Lopez. It was published a while back, but it's exemplary of the kinds of studies that are out there. And the researchers said, this study describes specific molecular mechanisms by which supplementation with N3 fatty acids, those which present in fish oils, can modulate the expression and activity of degradative and inflammatory factors that cause cartilage destruction during arthritis. Our data show that incorporation of omega-3 fatty acids, but not other polyunsaturated or saturated fatty acids, into articular cartilage chondrocyte membranes results in a dose-dependent reduction in the expression and activity of proteoglycan-degrading enzymes and the expression of inflammatory inducible cytokines. This is one study looking at the degradation of cartilage in the joints due to arthritis and how the omega-3 fatty acids helped modulate that degradation.
Absolutely. Yeah, well, that's definitely one of the main. That's one of the main scientific rationales behind why I use it. In addition to the fact that most of my population is probably going to be relatively omega-3 fatty acid deficient anyway for overall health, extending beyond their musculoskeletal system, along with some other supplements that I tend to use that patients walk out of my office with. The fish oil and omega-3 fats are huge.
Mm-hmm. And, of course, I'm a big fan of Nordic Naturals, and interpreting what Dr. Lopez, he seems to like Nordic Naturals a lot. I invite you to go to NordicNaturals.com. Take a look at the video they have on their website on how they make their fish oil. And, I always say, don't buy, when you're buying supplements, you must always be careful, where the raw materials came, and then how the raw materials are processed or otherwise manufactured. And with fish oils, you have to be especially cautious, because you could end up doing more harm than good. If you're eating rancid fish oil, you're consuming free radicals. Right. You're taking the fish oil to help fight against free radicals and inflammation and all those things. So be careful what brand you buy and where you buy it, and don't, and keep it out of sunlight and keep it out of heat. But sure. Nordic yeah, that's right, Dr. Lopez. And so when you're on your prescription, do you write Nordic Naturals for them or what?
Yeah, I typically do steer them in that direction, because they'll often ask me what brand I would recommend, and I tell them what brand I personally use and would personally recommend for all those reasons we've mentioned. And Nordic is definitely key for your fish oil supplementation. Absolutely.
You had mentioned the dosage level, and you said 3 grams. And I was a few weeks back, I had stopped off at a vitamin discount center store. Their store in South Tampa, and there was this elderly lady that came in, and she was buying some flaxseed or something, I don't know. And I ended up asking her why she was doing that, and she says, "Well, when I woke up this morning, I had all these plans." She was in her 80s. Right. And I looked down at her hands, and she had, Heberden's nodes on her hands, and their hands were in bad shape. So I knew she had osteoarthritis, and she said, "I was in such pain, there was nothing I could do to get my stuff done today." And I felt bad for her. So we were talking, and I said, "Well, what are you taking?" And I said, "Well, are you taking fish oil?" "Yeah, how much are you taking?" "About 1 gram. I said, "That's not going to get it done."
Soft gel, right.
It's not going to get it done. And
it's a spit in the ocean is what I tell my patients.
It's a spit in the ocean. Yeah. And you see this all the time. I mean, but my heart went out to her. And when she said she was in pain, all I had to do was look at her hands, and I knew. And then I was imagining, okay, what else is going on in her body with her other joints? And you can just imagine. So, and then yesterday, of all things, I was watching this story on the famous painter Renoir. Mm-hmm. And he lived to be elderly, and then he did some self-portraits of, and they had some photographs of him too, I believe it or not, black and whites, and you could see his hands. He must have had rheumatoid arthritis. He was confined to a wheelchair. He's painted all the way to the end, but his hands were so gnarled and so deformed from the arthritis. You can just imagine the pain must have been excruciating for him. Right. And then try to paint on top of that. But this goes on in everyday life. You see it all the time, right?
Absolutely. And then you end up running into things where it may start off as an inflammatory, chemical issue, and then it quickly becomes structural, as you can see, in patients who have these deformities. And that, obviously presents other challenges for us, for our team, for the rehab team, for some of the corrective exercise strategies, for some orthotics that we may need to include, manual medicine, et cetera, some of the other things we need to include in a patient's treatment plan.
Well, your patients are lucky to have you, Dr. Lopez. I can tell that just in this conversation we had today, you are compassionate, you care. I have expert.
They teach me something every day, my patients do.
Do they? Do they really?
Yeah, mutual. Absolutely.
Well, they're lucky to have you, and I have a lot of people come across these airwaves with me, guests, experts of one sort or another. The thing I always listen for, are they compassionate? Are they empathetic? Do they care about the audience? Do they care about their patients if they're doctors? You can be the smartest person in the world and know a lot, but at the end of the day, you got that other part has to be there too, I think, and I'm speaking both as a professional and as a patient. I want a doctor who knows his or her stuff, but is a human being with a heart and it cares. I think that means a lot. Don't you think?
Absolutely. No, you definitely bring up some important points. All the knowledge base in the world isn't going to get that knowledge to be applied to the appropriate patient when they need it if someone's indifferent or don't really go the extra mile to make sure that as many of the patients that you're trying to reach and as many lives as you're trying to reach are in fact being impacted by what you're trying to do for them. So.
Sure. And is there a website that people can visit to learn more about you and your practice?
Actually, it's www.northeastspineandsports.com, and it talks about our currently we have 2 offices in New Jersey, one in Point Pleasant, one in Jackson, and I'll also be launching a website as well, which will be drhectorllopez.com, and that's probably going to be launching over the next month or so.
It's www.northeastspineandsports.com.
Yep.
And Dr. Lopez can be found. He's in New Jersey. Get a phone number. So you never know. Somebody might get in contact with you. You have a phone number?
Yes. One of the main office phone number, 732-714-0070.
0070. Dr. Lopez, it was a privilege and a pleasure to have you on the show today. You were a first-time guest. You did a fabulous job, and I learned a lot from you. I know the listener did as well. You're welcome back on Let's Talk Nutrition anytime, and I know you got a busy practice, and you took out all this time to speak with the audience today and with me. I appreciate it so much.
It's been my pleasure, Dr. Garko. It's really been a pleasure. You've got a nice show here, so
thanks.
Keep it going.
All right, I'll look for you at one of the trade shows. Hopefully I'll get a chance to meet you. I'll be back. I'll have the health question of the day. Don't go away.
Are you suffering from those awful allergies? Hay fever, sneezing, watery eyes. Here's some advice you won't want to miss.
I'm a doctor, and my patients used to dread allergy season. But then I discovered A-Vogel Allergy Relief, a unique combination of natural ingredients that usually addresses every one of my patients' symptoms. And while it's clear that the vast majority of my patients benefit significantly from A-Vogel Allergy Relief, what's even more amazing is that after using it, at least half of my patients' symptoms didn't return. As a doctor, that's the kind of outcome my patients and I can appreciate.
Get doctor-recommended A-Vogel Allergy Relief for your allergy symptoms. It's proven safe, it doesn't make you drowsy, it's fast-acting, and it may even help prevent your allergies from returning. Available at vitamin discount centers, Richards, Rollin' Oats, Vitamin Shop, Nutrition Smart, and other fine health food stores.
Listen. Blissful silence. The sound of a healthy, balanced digestive system. No bloating, no gas, no flatulence, no loud gurgles, and most of all, no discomfort. Jarrow Formula's Ideal Bowel Support 299V contains a clinically documented probiotic strain, Lactobacillus plantarum 299V, that promotes regularity, enhances intestinal comfort, and optimizes immune health. Ideal Bowel Support 299V contains 10 billion L. plantarum 299V organisms per vegetarian capsule, proven to help your intestinal flora help you all day and every day. Ideal Bowel Support 299V does not require refrigeration and is a pure vegan formula. With the introduction of Ideal Bowel Support 299V, Jarrow Formulas continues to put the pro in probiotics. To sign up for a free sample of Ideal Bowel Support 299V, please go to www.jarrow.com.
From everyday challenges to life's toughest obstacles, TwinLab has the answers for life.
Honey, I was surprised when my doctor told me that heart disease is the #1 killer for both men and women.
Unfortunately, he's right. That's why it's more important than ever to take care of your heart.
TwinLab knows you only get one heart in this life, and you should take good care of it. For improved cardiovascular protection, choose TwinLab's innovative TwinSorb CoQ10, clinically proven to be more absorbable than most other CoQ10 products. Only TwinLab makes you feel this good. High blood pressure affects over 50 million people. TwinLab gets to the heart of the matter.
How's my blood pressure, Doc?
Don't worry. Good news. You're well within the healthy guidelines.
TwinLab's blood pressure control is specially formulated with clinically proven all-natural C12 peptide to help maintain already healthy blood pressure levels. Now and for the past 35 years. Only Twin Lab makes you feel this good.
These statements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any diseases.
Let's Talk Nutrition is brought to you by New Chapter, the benefit of nature's wisdom. Nordic Naturals, pure and great tasting omega oils. Genesis Today, food with purpose, pure and simple. Nutricology, innovative nutrition. Renew Life, the digestive care company. Panacea 315, superior quality, superior taste. Let's Talk Nutrition on the web at letstalknutrition.com. We're back from the break, so let's rejoin Dr. Michael Garko.
Go ahead. We had a little bit of a technical difficulty. That's fine. I'll deal with it this way. Microphone came apart on me. Welcome back to the final segment of Less Pain on Let's Talk Nutrition. Dr. Hector Lopez was my guest today, and he was absolutely terrific. He was a first-time guest, and you can, if you want to learn more about Dr. Lopez, you can go to northeastspineandsports.com. northeastspineandsports.com. He's up in New Jersey. His number is 732-714-0070. 732-714-0070. You never know. You might know somebody up there in the New Jersey area that could use a little musculoskeletal help, and Dr. Lopez seems like a terrific doctor. Here's the health question of the day. According to the CDC, how many Americans suffer annually from joint pain, roughly? Now, is it 60 million, 70 million, or 100 million? How many Americans suffer from joint pain? 60 million, 70 million, or 100 million? If you get the answer right, you win a $25 gift card to Vitamin Discount Center. 813-636-8255 is the local number. Toll free, 877-897-8255, 877-897-8255, or studio at letstalknutrition.com. And let's see here. Benny, real quick, he guessed 60 million. Nope, on studio, letstalknutrition.com. That's not right. So you got two choices left, 70 million or 100 million. How many suffer from joint pain in the United States? Roughly, it's an approximate. Jerry in Dunedin, I know you were holding. Jerry, what's on your mind today?
Well, I went to the orthopedic doctor, and he took x-rays, and he says, I have bone on my knee. I'm taking Flex now.
Yeah.
And I'm taking
And he's probably injected you with cortisone, right?
No, I wouldn't let him.
Okay.
It's only temporary.
Yeah, well, that
weakens the bone.
I understand. If you're bone on bone, I have some very recent experience with this, personal experience, in that my mother just had a knee replacement surgery, and I understand what this all is about. We've been dealing with this for a good while, and the cortisone is temporary. I'm not a big fan of cortisone, but in this case, I'm telling you that, and your doctor already said this, my guess is that he said you're a candidate for a knee replacement, and that's probably more in the near future than not, right?
Right. Well, would you get a second opinion if you were...
Well, you always get get a second opinion, but if you have the x-rays and you saw it was bone on bone, I can tell you there's going to be a lot of discomfort, and as time goes on, your loss of function will become even more prominent and greater, and you're not going to be able to cope with the pain. It becomes very difficult. And in this case, this would be a time when I would say, if he wants to give you some cortisone temporarily to be a bridge to when you have the knee replacement, that would probably be advisable, at least to manage the pain. I know it's temporary. I understand that. But this is a case where the joint is completely degenerated, and you're just looking to reduce the pain. So,
well, I walk the causeway. I walk the mall.
That's great. You should, because you want to maintain your cardiovascular and cardiorespiratory health. But as time goes on, that cartilage is not going to grow back, unfortunately. It's not going to regenerate. So,
doesn't flexion have it grow back?
No, I don't think so. No, there's no way to grow that cartilage back. If there were, believe you me, they would be doing. Now there's other kinds of techniques that they're using now, but that's a show for another day. But knee replacement is probably more than likely in your future.
I know.
And I can tell you that it can make an incredible difference. You can get back your function, and the technology is great these days compared to what it was 10, 20 years ago.
Well, I got a good surgeon, one of the very best.
Well, then you're fortunate, and you're relatively young. Because I know who you are.
I'm 83.
Yeah, well, my mother's 89, but you're in pretty good health, and so. But I'll be candid with you. I'll tell you what I told my mother. The surgery is challenging. The rehabilitation is challenging. If somebody tells you otherwise, they're not being honest with you. So you should know that. Right. And your doctor would probably tell you that. But if you're compliant, do what they tell you, rehab, do it the right way, you'll have a good outcome. With a good surgeon, you'll have a good outcome. But it is tough. That's a tough operation. That's the truth. I'm not going to tell you, it's a breeze, no problem. No. A full replacement, where all three compartments of the knee are replaced, is a challenging piece of surgery. And that's the truth. So, but I'll as I always say, I would rather be insane with the truth than deluded with lies.
Oh, yeah, I'm going to hold off until I can't walk. I'm not going to go through it
that'll probably happen. So your doctor, listen to your doctor, listen to your surgeon. So thank you for calling. I wish you the good. You let me know how that turns out, okay?
Yes, I will.
Yeah, you keep after it. Try to take the fish oils and all the things, the anti-inflammatories, to do the best you can to modulate it. But that's a tough deal when it's bone on bone, man. I mean, you got constant injury there, so the body's constantly trying to repair it. You got constant inflammation. I get it. If you have to, take a cortisone shot or two to tide you over to get you to the surgery date. It's probably sooner than you think, from what you're telling me. But you talk to your doctor, okay?
He gave me a medication for pain, but I didn't fill it. I don't want it.
All right, good enough. I know you're tough. You hang in there, though, okay?
All right, take care, Dr. Carco.
You do the same, Jerry. All right, we didn't have any takers on the answer to today's health question. It was 70 million. That's the number of people who suffer from joint pain. Dr. Lopez was terrific. The show is archived. Both hours are archived on my website at letstalknutrition.com under show schedule. Thank you so much for tuning in today. It's always great to be with you. And your health means a lot to me. And please never forget, your health is your wealth, and your health is the wealth of those who care about and love you. Take care of yourself. I'll see you tomorrow.
Hi, I'm Brenda Watson with Renew Life. Does it seem like every time you eat, you get heartburn and indigestion? Do gas and bloating sometimes have a way of ruining a good meal? Digestive enzyme supplements can help you eat the food you love without the uncomfortable side effects. My Digest More Ultra formula is the strongest digestive enzyme available, with 14 different plant enzymes proven to help with difficult digestion. Just one easy-to-swallow capsule with every meal helps your body break down a variety of foods and absorb more nutrients. If you have a sensitive stomach, try our Digest More formula. It combines the digestive power of pure plant enzymes with soothing herbal ingredients and amino acids to nourish and protect the lining of the intestines. All Renew Life supplements are free from fillers, binders, or added ingredients. Look for the yellow sun on Renew Life products, available at health food stores everywhere.
It's not about showing off. It's not about picking up guys. It's about getting results. It's Shapes Total Fitness, and it's all women. And they're looking better every day. Do you want results? Then call 850-SHAPES and be a little selfish. Enroll now and get the summer free.
Love the products Dr. Garko discusses on Let's Talk Nutrition? Having trouble finding all of them in one convenient location? After you shop your favorite local health and nutrition store, visit VDCUSA.com for hard-to-find products. With over 3,000 items, VDCUSA.com is your neighborhood nutrition resource, no matter where you live. VDCUSA.com offers a great selection of products and great customer service, and you can save up to 50% off the products you love and trust. VDCUSA.com. For life, for less.
It's not about showing off. It's not about picking up guys. It's about getting results. It's Shapes Total Fitness, and it's all women. And they're looking better every day. Do you want results? Then call 850-SHAPES and be a little selfish. Enroll now and get the summer free.
Statements made during this broadcast regarding products or the claims made about specific products have not been evaluated by the U.S. Food and Drug Administration. Products and treatments discussed are not intended to diagnose, treat, cure, or prevent disease. Make your physician aware of all nutritional supplements used and immediately notify your physician if you have any health concern or undiagnosed sign or symptom.